Hello, we're back. We're going to continue our discussion of coding diabetes. We'll finish that up and then we'll get into coding other endocrine disorders. And I think we left off right about here. So anytime we have secondary diabetes and there's insulin, oral hypoglycemic drugs, or injectable non-insulin drugs, we want to make sure we capture that. And we would use codes from code category Z79 for long-term use of insulin, oral hypoglycemic drugs, or the injectable non-insulin drugs. An important point is if both oral medications and insulin are used, we would use both the codes Z79.4 and Z89.84 to indicate the use of both medications. If a patient's being treated with both insulin and not and a non-insulin anti-diabetic drugs, we would assign those codes, the Z79.4 for the long-term use of insulin and Z79.899 other long-term current drug therapy. However, if a patient's being used with oral hypoglycemic drugs and injectable non-insulin anti-diabetic drugs, we would assign Z79.84 for the oral hypoglycemic drugs and the Z79.899 other long-term drug therapy. The code of Z79.4 is not assigned if the insulin is given temporarily to bring a type 2 under diabetic during a hospitalization or other encounter. Code E15 is used to describe a non-diabetic hypoglycemic coma. Drug-induced hypoglycemia, E16.0, is used in this drug-induced hypoglycemic case, and other unspecified hypoglycemia will fall into code subcategories E16.1 and E16.2. Hypoglycemia can occur without diabetes and requires lab tests for a complete diagnosis. Please review Figure 7.1 to see the organs that are affected by Zollinger-Ellison syndrome. One or more gastrinomas develop in the pancreas or duodenum and release abnormally large amounts of gastrin hormone that causes the stomach to produce excessive amounts of acid. This can produce severe peptic ulcers in the duodenum or other parts of the upper GI system. There are other disorders of the endocrine glands, and of course, we have 8 major ones. These include the pituitary, pineal, thyroid, thymus, adrenal, pancreas, testes, and ovaries. And these disorders are coded to code categories E20 through E35. For any conditions that's related to the use of medication, there are notes included in the tabular to remind you to use the additional codes for the adverse effect to identify the drug or the chemical. Cushing syndrome results from excessive cortisol due to a pituitary tumor synthetic hormone use. Treatment includes either medication or surgery. Addison's disease is primarily adrenal cortical insufficiency. The adrenal gland doesn't produce enough cortisol or androgens. The cause includes autoimmune disease. Treatment is hormone replacement and fluid regulation. Then our last slide, we're going to cover polycystic ovarian syndrome. Polycystic ovarian syndrome is characterized by anovulation, amenorrhea, and infertility. It increases the risk for endometrial cancer. Treatment includes both hormonal birth control and insulin sensitizing medications. And that's all I have for you. Please come back and watch our next video lecture where we'll cover the coding of endocrine disorders. Bye now.